Suicide is a critical public health concern that can have harmful lasting effects on individuals, families, loved ones, and communities. While its causes are complex and determined by multiple factors, the goal of suicide prevention is simple: reduce factors that increase risk and increase protective factors that promote resilience. Prevention addresses all levels of influence: individual, relationship, community, and societal. There are coalitions across the state of South Dakota that support these efforts in their local communities by raising awareness and providing training. Suicide prevention coalitions are groups of diverse individuals or organizations of people who work together to reach a common goal. In a sense, a coalition is an organization of organizations. To learn more about community coalitions, visit the Community Toolkits for Preventing Suicide page at sdsuicideprevention.org. Here in the state of South Dakota, we also have 3 prevention resource centers that provide regional support across the state to students, parents, educators, community groups, community agencies, law enforcement, and any other interested entity looking for prevention resource materials or support. Each Prevention Resource Center has a resource library with videos, DVDs, books, CDs, brochures, and curriculum available for public use. The 3 Prevention Resource Centers in South Dakota are located in Sioux Falls, Watertown, and Rapid City. Additionally, the Helpline Center is a part of the National Suicide Prevention Lifeline and answers the 1-800-273-8255 line for South Dakota. The Helpline Center offers a variety of suicide prevention training, crisis support, and survivor services that include grief support for individuals who have lost a loved one to suicide. The Helpline Center is the only accredited suicide prevention, intervention, and aftercare organization in South Dakota. One available resource for teens is the Helpline Center's Text for Hope support program. This is a statewide number available for adolescents to use if they need to talk. The Text for Hope program provides crisis texting support for all high school students in the state of South Dakota. Since texting is the preferred means of communication for adolescents, offering a crisis texting program allows students to share their concerns privately with trusted staff. The Helpline Center's Text for Hope program provides support for any individuals experiencing a crisis. Trained crisis staff are available to listen without judgment, and professionals will provide support and resources for a variety of reasons, including mental health concerns, thoughts of suicide, concerns about friends, family, home life, or school, or if students just need to talk to someone. Support is available year-round, 24 hours a day, 7 days a week for all high school students in the state. The Text for Hope line is safe and private, and there is always someone available. The Helpline Center also offers youth mental health first aid training available for adults who regularly work closely with adolescents. This 8-hour program introduces participants to the risk factors and warning signs of mental health concerns in adolescents, builds understanding of the importance of early intervention, and teaches individuals how to help an adolescent in crisis or experiencing a mental health challenge. Youth mental health first aid meets the suicide awareness and prevention training requirement for educator certification. To request a youth mental health first aid training, contact the Helpline Center or the Department of Social Services Division of Behavioral Health at 605-367-5236. South Dakota's community mental health centers also provide mental health services to youth and adults across the state. Services include screenings and assessments, case management, individual therapy, group therapy, and crisis intervention. Youth whose families meet programmatic and financial eligibility guidelines, or who have considerable personal circumstances, may qualify for state-funded services. There are also many school-based mental health providers in the state, which include school counselors, school psychologists, school social workers, and community-based clinical mental health counselors and social workers. These professionals support each other while bringing unique training and expertise to address the academic, career, and social, emotional, and behavioral needs of K-12 students. These are just a few of the resources within the state of South Dakota, though there are many other supportive services available. Please feel free to contact the University of South Dakota Center for Disabilities at 605-357-1430 with questions or for further information.